So this gets us to our next category of genetic diseases, that is chromosomal abnormalities. You very well know कि chromosomal abnormalities को हमने दो में divide करा है, that is chromosomal abnormalities in number and structure of chromosomes. You know that. So let us start with chromosomal abnormalities. सबसे पहले मुझे ये बताओ, what is the investigation of choice, IOC, what is the investigation of choice for chromosomal abnormalities? Investigation of choice for detection of chromosomal abnormalities is karyotyping. Investigation of choice is karyotyping or conventional cytogenetics. It is karyotyping or conventional cytogenetics. What does this mean? Before we go further, let us have a look at what a karyotype looks like. This is conventional cytogenetics or karyotyping. The minute I see this, I am able to make out कि there are 22 pairs of chromosomes. देखो ये सारे chromosomes numbered है ना, 1 2 3 4 5 6 ऐसे सारे numbered हैं. So there are 22 pairs. There are 22 pairs of chromosomes, 1x 1y plus 1 xy. That means this is a male. अगर दोनों x होते, suppose y ना होता, if it was XX, it would have been female. So this is what a normal karyotype looks like. This is a normal karyotype. So whenever you are given karyotype analysis, हमेशा सबसे पहले तो ये देखना है कि XY है कि नहीं है. That is the first thing that you have to see. या तो XY हो या XX हो. Suppose there is no Y and there is only one X, then it becomes total number of chromosomes 46 नहीं रहे ना, 45 हो गए, तो वो हो गया 45XO. That is turnus. अगर 2x हो गए, double XY हो गया, then that is Klinefelters. So first thing that you have to see is कि x और y ठीक है कि नहीं. Next you have to check कि all the chromosomes should be in pairs. दो होने चाहिए. Suppose there is a third chromosome 21, trisomy 21, that is Down syndrome. Trisomy 21, that is Downs. अगर trisomy 18 है, trisomy 18, that is called as Edwards syndrome. Trisomy 18 is Edwards versus trisomy 13, that is Patau's syndrome, versus trisomy 13, that is Patau's. Patau's में T भी आ रहा है ना, Patau's में T is coming, so trisomy 13 Patau's. This is a nice normal karyotype. This is a nice normal karyotype. This is what you have to see when you get karyotype analysis. Now you tell me कि अगर ये वाला, if you have been given this image, what is the diagnosis in this? Of course, this is conventional cytogenetics or karyotyping. The minute I see this, सबसे पहले मैंने देखा XX है. That means she is a female. She is a female. What is the problem in this karyotype analysis? It has 3 chromosome 21. That means diagnosis Down syndrome. Diagnosis Downs. So first point, investigation of choice. Investigation of choice for chromosomal abnormalities is conventional cytogenetics or karyotyping. How is it performed? In conventional cytogenetics or karyotyping, in this we add colchicine. इसमें हम लोग colchicine add करते हैं. We add colchicine or colcimid. एक ही बात है. We add colchicine or colcimid, which is a mitotic spindle cell inhibitor. It is a mitotic spindle inhibitor. It inhibits mitosis. ये spindle formation को inhibit करता है. It inhibits mitosis at metaphase. It inhibits mitosis at metaphase, as a result of which we see the chromosomes being scattered. एक अच्छा सा हमें chromosomal pattern नजर आता है, and we are able to appreciate whether it is normal or if it is associated with some abnormality. This is conventional cytogenetics or karyotyping. Next point. So let us start with chromosomal abnormalities. Let us start with chromosomal abnormalities in number of chromosomes. Chromosomal abnormalities associated with chromosomal abnormalities associated with number of chromosomes, associated with number. First point, the first I can divide chromosomal abnormalities in number into two types. इसको हमने दो में देखा, या तो बच्चे यूप्लॉइडी हो सकता है. The first chromosomal abnormality in number is euploidy. Euploidy. That means it is an increase in number of chromosomes. Euploidy. It is an increase in number. It is an increase in number of chromosomes in multiples of n. It is an increase in number of chromosomes in multiples of n. What is n? N is the haploid number. N is the haploid number, that is 23. All of us, what is normal? All of us, bache, we are 2n. We are diploid. All of us, we are diploid. We are 2n. That is, we have 46 chromosomes. So euploidy, it is an increase in number of chromosomes. It is an increase in number of chromosomes in multiples of n. So examples of euploidy are 3n or 4n. Examples are 3n or 4n. This is euploidy. Next, the next chromosomal abnormality in number of chromosomes is aneuploidy. Next chromosomal abnormality in number is aneuploidy. This is an abnormal number of chromosomes. This is an abnormal number of chromosomes, not in multiples of n. Not in multiples of n. So examples of aneuploidy are 2n plus 1. क्या example बना? 2n plus 1, 2n plus 1 or 2n minus 1. 2n plus 1, 2n plus 1 मतलब this is the trisomies. These are trisomy. Trisomy 21 Downs, trisomy 18 Edwards syndrome, trisomy 13 Patau's syndrome. These are the trisomies versus 2n minus 1, which are the monosomy. Versus 2n minus 1. 2n minus 1 matlab one chromosome is lost. 2n minus 1, that is monosomies. So chromosomal abnormalities in number of chromosomes, हम लोगों ने दो टाइप का देखा. Euploidy, which was abnormality in number in multiples of n, and aneuploidy, that is abnormal number of chromosomes not in multiples of n. Not in multiples of n matlab 2n plus 1 or minus 1. 2n plus 1 is trisomy, 2n minus 1 are the monosomies. Next point. So let us start. अच्छा, एक चीज और देखते हैं. Another chromosomal abnormality. We have seen euploidy and aneuploidy. Another chromosomal abnormality is mosaicism. Next chromosomal abnormality, which is next chromosomal abnormality, is a mosaic. Mosaicism matlab a particular person has two different sets of chromosomes. Mosaicism matlab different sets or different types of chromosomes. Different sets or different types of chromosomes in a particular individual. That is called as mosaic. मतलब एक ही इंडिविजुअल, एक ही पर्सन या एक ही इंडिविजुअल में दो टाइप के सेल पॉपुलेशन है. सम सेल पॉपुलेशन आर नॉर्मल एंड सम हैव अ डिफरेंट टाइप ऑफ क्रोमोसोम नंबर. दैट इज कुछ नॉर्मल है फॉर एग्जांपल एंड कुछ में ट्राइसोमी 21 है, दैट इज कुछ में डाउन्स है. दिस इज कॉल्ड एज mosaicism. Different sets or different types of chromosomes in a particular individual. Next point. So let us start. Let us start with chromosomal abnormalities in number. Let us start with our first topic in this, that is chromosomal abnormalities. Chromosomal abnormalities in number of chromosomes, and let us start with the first one in this, that is Down syndrome. Starting with the first one, that is Down syndrome. पहले वाले से शुरू करते हैं ना, that is starting with Downs. What is Down syndrome? You already know Down syndrome. This is trisomy 21. This is trisomy 21. क्यों होता है? ट्राइसोमी 21 मतलब दो क्रोमोसोम 21 तो नॉर्मल नहीं है. वी गेट वन क्रोमोसोम 21 फ्रॉम द मदर, वन फ्रॉम द फादर. इसमें एक एक्स्ट्रा क्रोमोसोम 21 है. वाई? What is the pathogenesis? What is the pathogenesis of Downs? Extra chromosome 21 कहाँ से आया? This occurs because of maternal meiotic non-disjunction. This occurs because of maternal meiotic non-disjunction. Maternal meiotic non-disjunction of chromosome 21. मतलब मदर में